Hi, this video is a self-care cupping tutorial to be used under the care of your healthcare practitioner. All the methods developed in our series were designed using the Fascia Buddy Silicone Cups. Other brands of silicone cups may use different hardness levels, which may affect your ability to perform some of the processes outlined in these videos. Cupping is an excellent way to stimulate circulation, rehydration, and it also stimulates your body's healing response. Your practitioner may have recommended a particular size for you to use. You can purchase that size individually, or you can purchase a set of 4, as in this case here, which can be used with the different cups can be used for different circumstances as they arise. This self-care video demonstrates the self-care process of working on the hands and the various conditions on your hand. Today's little video vignette will be on using silicone cups, Fascia Buddy Silicone Cups, for hand pain, arthritis, not the hot arthritis, but the just osteoarthritis, sore hands, Dupuytren's contracture, stiffness in the hands. And the method that we'll show today will be helpful to help relieve or to improve those symptoms while you're getting care from your practitioner. The Fascia Buddy set comes in a set of 4 or individually, and your practitioner may have recommended a particular size for you. Depending upon the size of your hands, you will choose the cup that is most appropriate for the size of your hand. If you have very large hands, the small one, or with regular size hands, you could use the extra small. And I recommend, for most hands, the extra small will be most useful. In the package, there is a set of instructions that you should review. Your practitioner will have given you specific instructions, but also there's some instructions for you to review and understand. This method could be done easily at home while you're watching TV, while you're just resting or chatting away with anybody. But in general, what you want to do is you want to expose your forearm and your hand. You want to have a lubricating oil of some sort that is not too creamy, but more oily, something like coconut oil, or we have a liniment here that's apricot oil with a little bit of infusion of other herbal botanical products that help to stimulate circulation. You have your cup and you have your oil, and I want to show you that the cup has the dome and the lip area. And what you want to do is you want to be able to place this cup on the surfaces, various surfaces, for your treatment. To apply the cup, there's a number of different methods depending upon your hand strength. If you have normal hand strength, you can just take the cup, put your fingers under the lip at the bottom and your thumb on the dome at the top. You'll take the one edge, place it on your palm so that that you're catching the one edge, and you're pushing with your thumb and pulling with your fingers and applying the cup so that you're flattening it and getting a very strong suction. And if you look, you can see there's a dome in here. That indicates you've got a very strong suction. For those of you that don't have as strong fingers or your hands are a little bit compromised, you may try to pull with your finger and then push with the rise of your thumb palm here, the thenar eminence. You can pull and push that way. So now I'm pushing with my palm, and I can create a similar action. If that does not work, you can try collapsing the cup and placing it on your palm, although the pressure is not as strong in that manner. In any way, you want to try to get as strong of a a pull as possible that is comfortable. If you can't do this yourself, you could also ask someone in the household to apply it for you in the manner that I'm describing here. So, take the oil and you're going to rub it over the palm of your hand. You want to dry your fingers so that you can apply, and you're going to place the cup on the center of the palm by stretching your hand as wide open as possible so your skin is tight and firm. Place the cup on, and now what you're going to do is you're going to do a twisting motion like this. And while you're twisting, you're going to move the cup in and around the curvy surfaces of your hand. And now, if you have the Dupuytren's contracture, or if you have a tight tendon here, you can slide it up and down. You can twist it like so, and up and down along that tendon. And this may be very painful for those that have a very tight, locked finger. And so you can adjust the pressure, again, by how much force you push down. So you don't have to go all the way down where you're flattening it completely. You can kind of do a partial level, and then use that as your starting point. And as you work this every day for 3 to 5 minutes, you will be able to then increase that pressure over time, and you will find that the ability for the tissues underneath to move on top of each other will start to be restored. You can also move your finger back and forth while the cup is on your hand, so you can kind of position it and do this type of movement again. And if your finger does get locked, you can kind of like help it unlock, and you'll find that maybe one of the spots will be the most difficult. But in general, what you want to do is, once you've worked that area, if that's an area specific to you, or if you just have sore hands or weak hands, or you're a manual therapist in some ways, you can just work the tissues all the way around. And see, if I lose pressure, I just reapply. And this twisting motion, along with the directional movement, helps me get the cup in all these irregular surfaces, which is unique to the Fascia Buddy or silicone cups in general. So the twisting and gentle movement, and you want to do this for 3 to 5 minutes every day. And it feels so good. It's unbelievable how good it feels. So you can play around with different movements. You can try, depending if you have various areas might be more tender. You can work them by slightly pulling the cup gently, not so much that you're pulling it off, but just gently pulling it away and stimulating. Again, there's twisting motion with directional movement. There's vibrational movement. You can do that also. So there's a lot of different ways that you'll start to play with yourself that will allow you to work the cup over all the surfaces and stimulate that. So also, we want to work the connective tissue on that extend and flex the hand. So we want to loosen these up also to help with the general circulation and the tension in our fingers. So in this case, I recommend for another few minutes just lubricating the forearm, top and bottom. And you want to get all the different muscles that are associated with that. And to start, you probably choose the flattest area of your elbow. And see how I'm leaving a mark here? So you want to cover the table or the area you will be doing this work with. Place the cup on again with that same pulling underneath, pushing on top. And then gliding the cup up and down through these muscles here. Moving up and down. You can flex your hand and just stimulating. Now I'm doing the squeezing method where I'm squeezing the cup and plunking it on. If you have sensitive skin, you might want to start with this one to see how your skin handles it. And you can see this nice, beautiful flushing that happens, which is indicative of circulation, fascial change, and rehydration, and waste material removal. Similarly, you can do from the other side, where you're doing the flexor side, and again you can move the cup up and down. You can use the twisting motion. If you lose pressure, you just simply re-grab by pushing. And I find that when you're pushing, to push from the bottom part and then pull from the bottom, push back. So find the right amount of pressure. In this case, I might want to use the medium-sized cup because it's a larger area. And I get a lot more pull, and it's a little bit more stable. So you can adjust the cups to work. You want to work as far along the chain as possible. And you do that for a minute on each side, and you will have stimulated circulation in your hands and all those muscles that stimulate the muscles in the hand, that manipulate the fingers. Do this for 3 to 5 minutes every day. Talk to your practitioner, and they will monitor your results and offer any further suggestions. Okay, in summary, after showing that technique, I want to just remind you that you need to be careful with the amount of pressure you use. Make sure you find the right level for you that's not too painful. If you see any discoloration that may occur, like on the hair, that could even get a little bit purplish or reddish, that's normal, as you can read in the instructions. But talk to your practitioner for further guidance. They'll take you through any additional protocols that you may need to do, or exercise movements that you can do with the cups on your hand. Okay, thank you.